Autism spectrum disorder, or simply autism, is a complex condition where there is a difference in how the brain develops and functions. This difference affects how people with autism communicate, interact with others, and experience the world around them. It's important to understand that autism isn't an illness or disease. It's a neurological difference that's part of who a person is. It's called a spectrum disorder because it covers a wide range of symptoms and abilities. Some people with autism might need a lot of support in their daily lives, while others might need very little. Autism is more common than many people realize. According to recent studies, about 1 in 36 children in the United States is diagnosed with autism, and it's about 4 times more common in boys than in girls. However, there's growing awareness that autism might be underdiagnosed in girls, as they often show different symptoms than boys. Causes of autism. The exact causes of autism are still not fully understood. It's likely that multiple factors work together to influence a person's likelihood of developing autism. Let's start with genetics, which plays a major role in autism. Scientists have identified hundreds of genes that might be involved in autism. These genes affect how brain cells communicate with each other or how the brain develops. If a person has certain variations in these genes, they might be more likely to have autism. Here's an interesting fact. If one identical twin has autism, there's about a 70 to 90% chance that the other twin will also have it. For non-identical twins, this drops to about 20 to 30%. This shows us that genes are important, but they're not the whole story. It's also worth noting that having these genetic variations doesn't guarantee that someone will develop autism. Think of it like a recipe. You might have all the ingredients for a cake, but you still need to mix them together and bake them for the cake to form. Now let's talk about environmental factors. These are things that happen during pregnancy, birth, or early childhood that might increase the chance of autism. One environmental factor is the age of the parents. Children born to older parents, both mothers and fathers, have a slightly higher chance of having autism. We're not entirely sure why, but it might be related to changes in eggs and sperm as people get older. Complications during pregnancy or birth might also play a role. For example, if a mother gets very sick during pregnancy, especially with a fever or infection that affects the immune system, this might slightly increase the risk. Extreme prematurity, being born very early, or very low birth weight are also associated with a higher chance of autism. It's crucial to mention that vaccines do not cause autism. This idea came from a study that has since been thoroughly debunked. Many large, well-designed studies have shown that there's no link between vaccines and autism. Symptoms of autism. One of the core features of autism is differences in social communication and interaction. People with autism might have trouble understanding social cues, like facial expressions or tone of voice. They might struggle with back-and-forth conversation or with understanding sarcasm or jokes. Some might avoid eye contact or have difficulty forming and maintaining friendships. Another key aspect of autism is restricted or repetitive behaviors or interests. This could mean having very intense interests in specific topics or needing to follow strict routines. Some people with autism might engage in repetitive movements, like hand flapping or rocking. They might also be very sensitive to certain sensory experiences, like loud noises or certain textures. But what does autism feel like from the inside? While everyone's experience is unique, many people with autism describe feeling overwhelmed by sensory input. Sounds might seem louder, lights brighter, or textures more intense. Social situations can feel confusing or exhausting, like trying to understand a language you've never learned. At the same time, many people with autism report experiencing the world in vivid and unique ways. They might notice details that others miss, or have a deep, passionate interest in specific topics. Some describe feeling a strong sense of justice, or a desire for logical consistency in the world around them. Communication can be a challenge for many people with autism. Some might be nonverbal or have limited speech. Others might speak fluently, but struggle with the social aspects of communication, like understanding tone of voice or body language. This can lead to feelings of frustration or isolation. Many people with autism also experience what's called executive function difficulties. This means they might struggle with planning, organizing, and switching between tasks. Time management can be challenging, and they might have trouble starting or finishing tasks. It's important to note that autism often comes with strengths as well as challenges. Many people with autism have exceptional memory skills, strong attention to detail, or the ability to think outside the box. Some excel in fields like mathematics, music, or art. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of autism. There's no single medical test that can diagnose autism. Instead, diagnosis involves observing a person's behavior and development. This process usually starts when parents or caregivers notice that a child isn't meeting typical developmental milestones, especially in areas of social communication. A comprehensive diagnostic evaluation typically involves a team of specialists, including psychologists, speech-language pathologists, and occupational therapists. They'll observe the child's behavior, conduct various assessments, and gather information from parents about the child's developmental history. For older children, teens, or adults, the diagnostic process might involve more direct interviews and self-reporting of symptoms. It's worth noting that many people aren't diagnosed with autism until adolescence or adulthood, especially if their symptoms are more subtle. The diagnostic criteria for autism are outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. To be diagnosed with autism, a person must show persistent difficulties in social communication and interaction, as well as restricted and repetitive patterns of behavior, interests, or activities. These symptoms must be present from early childhood and must cause significant impairment in important areas of functioning. Treatment for autism. It's important to understand that there's no cure for autism. It's a lifelong condition. However, there are many interventions and supports that can help people with autism develop skills, manage challenges, and improve their quality of life. One popular early intervention approach is applied behavior analysis, ABA. ABA uses positive reinforcement to encourage desired behaviors and skills. For example, a child might get praise or a small reward for making eye contact or using words to communicate. ABA can be intensive, sometimes involving 20 to 40 hours of therapy per week. While it's been shown to be effective for many children, it's also been criticized by some in the autism community for being too focused on changing autistic behaviors rather than accepting neurodiversity. Speech and language therapy is another crucial component of autism treatment. This isn't just about teaching kids to talk. It's about communication in all its forms. For nonverbal children, this might involve learning to use picture boards or digital devices to communicate. For those who can speak, it might focus on understanding social language, like sarcasm or figures of speech. Occupational therapy is also super important. Despite its name, it's not about jobs. It's about the occupations of daily life. Occupational therapists help people with autism develop skills for everyday living, from buttoning a shirt to using utensils. They also often work on sensory processing issues, helping individuals cope with sensitivities to things like loud noises or certain textures. As kids with autism get older, educational interventions become a big focus. Many children with autism benefit from special education services. This might involve having an individualized education program that outlines specific goals and supports. Some kids do well in mainstream classrooms with additional support, while others might benefit from specialized autism classrooms or schools. Social skills training is another key area. This might involve structured lessons on how to start conversations, understand body language, or navigate social situations. Some schools or clinics offer social skills groups where kids can practice these skills with peers. For many people with autism, especially as they get older, mental health support becomes important. Anxiety and depression are common in people with autism, and cognitive behavioral therapy, CBT, can be really helpful. Some therapists specialize in working with autistic individuals, adapting their techniques to meet the unique needs of this population. Now let's talk about medications. There's no medication that treats autism itself, but meds can be used to manage specific symptoms or co-occurring conditions. For example, some people with autism might take medications for attention difficulties, anxiety, or sleep problems. It's always important to work closely with a doctor to find the right medication and dosage, as people with autism can sometimes react differently to medications. It's important to note that views on autism treatment are evolving. There's a growing movement towards neurodiversity, which sees autism as a difference to be respected rather than a disorder to be cured. This approach focuses on supporting autistic individuals to thrive as they are, rather than trying to make them normal. Ultimately, the goal of autism treatment and support is to help individuals with autism lead fulfilling lives according to their own goals and values. Now, we want to hear from you. Do you or someone you know have autism? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.